Hello viewers, I am Dr. Balakumari. I am an obstetrician and gynecologist practicing for the past 25 years. In this video presentation, we will give you information about the care of the pregnant women during pregnancy. Pregnancy is the happiest occasion in any woman's life, but at the same time, the women undergo lot of emotional conflicts. First, she is happy that she is pregnant, but then she is worried also. Lot of common ailments that happen during pregnancy make the woman worry whether it is normal or abnormal, and she doesn't know why they do so many scans and why they do so all these blood tests. To clear all these doubts, this video presentation will be very useful. This video presentation is not a substitute for a consultation with your obstetrician. Each obstetrician will vary in their way of practicing. There may be a slight difference from what I say. I am saying what is commonly accepted and practiced. If your obstetrician says something different, it may be because there may be a slightly different condition which is happening to you. So please don't worry. Your goal and our goal is the same, to have a healthy baby and a healthy mother at the end of pregnancy. To achieve this without any stress, you need to have a lot of information. The better informed you are, the more prepared you are for the childbirth, and the childbirth experience will also be a pleasurable one, even if it is a painful one. How do we calculate the expected date of delivery, which is called EDD? The duration of pregnancy is 280 days from the last menstrual period, or 40 weeks, or 10 lunar months. Why do we take the last menstrual period as the milestone? Because all of you know that conception happens on the day of ovulation, which is after 14 days of last menstrual period. But since we do not know the exact day of conception and last menstrual period is the definite milestone, we take that into account. So the pregnancy is calculated from the last menstrual period. How do we calculate the expected date of delivery? That you should know. A simple calculation is like this. We subtract 3 months from the last menstrual period, then add 7 days. For example, if the last menstrual period was on 7/10/2010, then the expected date of delivery will be 14/7/2011. Supposing the last menstrual period was 29/10/2010, then the expected date of delivery will be from 29/10 you subtract 3 months, that will be 29/7, then you add 7 days. With 29 if you add 7 days, it will be 5th of August. Okay. So 5/8/2011 will be the delivery date. Supposing the LMP was 3/3/2010, then the delivery date will be 10/12/2010. Okay, this is how we calculate. This calculation is applicable for people who have regular periods. But the woman, if she has irregular periods, it has to be calculated by the first scan that we do, which is called the dating scan. If the woman has a little delayed periods but regular periods, say once in 35-day cycle, then the EDD will also be delayed by those 7 days. See, normal cycle is 28 days. Supposing she has 35-day cycle, her EDD will be 7 days plus with the calculation that we do. The duration of pregnancy is 40 weeks. It is divided into 3 trimesters. The first 12 weeks is called the first trimester. 13 to 28 weeks is called the second trimester. 29 to 40 weeks is called the third trimester. What is the significance of dividing into 3 trimesters? The trimesters, each one has its own significance. The first trimester is more prone for abortions. Nearly if 100 people conceive, 30% of the women do abort. Sometimes they realize that they are pregnant and abort. Sometimes they don't. It becomes very early abortions. The first visit to the doctor should be as early as possible. That is the moment you know that you are pregnant. Then the next visit can be at the end of first trimester around 12 to 14 weeks. In the second trimester, it is relatively a risk-free period. The woman has less sufferings, the complications are less. This is between 13 to 28 weeks. During this time, the woman has to visit the doctor every month, once in 4 weeks. In the third trimester, between 29 to 40 weeks, the woman has to visit the doctor every 15 days till 36 weeks. That is 29 to 36 weeks, she will have to visit every 15 days. After 36 weeks, she has to visit every week. The first trimester, as I told you, is more prone for abortions. So we usually tell the woman to inform others that she is pregnant only after 12 weeks. The abortions happen because the fetuses which are formed are chromosomally defective. It is nature's way of selecting the best. It deletes the unwanted. In spite of this selection, some abnormal fetuses continue to grow. That is the purpose of doing a second trimester scan. Second trimester, around 20 to 22 weeks, we do an anomaly scan to know whether if the baby is alright. And during the second trimester, as I told you, the difficulties are less. And in the third trimester, we ask you to come more frequently. Why is that? Lot of newer complications can start for the first time during the third trimester, especially after 36 weeks. So we want you to see frequently so that we can assess the woman and her baby. The baby's growth will be assessed. We will be looking for the complications that may arise during the third trimester, like increase in BP, diabetes, edema, and all the other things we will be discussing later.